Sure. My name is Tony Black. I'm the Global Director for Healthcare, Privacy, and Digital Transformation for Kyndryl. And I also lead the Healthcare Guild. And the Guild is global in nature. And the Guild really consists of people across the company who either have an acumen, experience, responsibilities, or simply an interest in the healthcare industry. Additionally, I have multiple board positions with HIMSS, the Open Group, and NESBE, the National Society of Black Engineers, where I have a leadership focus in the industry, working on frameworks, business models, best practices, and standards. And lastly, I like to volunteer in my own community for health and safety duty as a member of CERT, the Community Emergency Response Team, where we're trained in things like first aid, CPR, how to use a defibrillator, etc. Now, healthcare doesn't have a technology problem. Healthcare has great technology. Everything from imaging to robotics. And there's tons of great technology coming into the field. What we need to focus on, and now we have AI on the rise as well, that where healthcare leaders are trying to figure out new, innovative, creative ways to introduce and leverage AI. I think some of the focus should be on the combination of people, process, and technology, because we need people who are trained and certified to use this technology as it comes into the healthcare field. Well, when you think about data privacy and data management and data in general in the healthcare field, you have to think of the entire life cycle of data, right? So you have data collection, whether that's coming in through the digital front door or through mobile apps. You have data security, data storage, data encryption, data mining, so using intelligent algorithms to mine the data for further patient outcomes to help patients. You also have data classification, right? Because is it data sensitive? Is it public? Is it private? Is it proprietary? So you have to understand that what the type of data is that you're dealing with. And also data can't be online and available forever. You have to have data disposal techniques as well to archive that data. So again, there's no shortage of healthcare, there's no shortage of data in healthcare, and as data continues as we continue to grow, we just need to practice good data cleansing, data structure techniques. Healthcare organizations are particularly vulnerable to cyber attacks because of the large amount of information they possess that's considered valuable for cyber attacks. We're talking PHI, protected health, personal health information. We're talking personally identifiable information like social security numbers. You have financial information like account numbers, bank account numbers, credit card numbers. And all of that information is considered extremely valuable. And if it got into the wrong hands, it could be very dangerous for individuals. As a member of the board of directors of the Open Group, I use my platform to promote and evangelize the great things we're doing within the Open Group. We have 900 member organizations and a very large member-based community. And we have tons of work groups and forums. And we have representation across the board from every work group and forum, every technology, and every industry that you could think of. So we have thought leaders that come together that work on frameworks and business models, not just technology alone. As the co-chair of the HIMSS Cybersecurity and Privacy and Security Committee, I lead a strong organization of thought leaders and professionals across the healthcare industry. Their focus is cybersecurity, privacy, as well as security. We provide resources that enable companies to leverage best practices on protecting health information, as well as enabling processes and technologies to help protect themselves against cyber attacks. AI can enhance patient care, support for healthcare professionals, and being safe for everyone to use. There's current discussions right now with healthcare leaders involving the adoption of AI to augment clinical practice, establish financial models, and have good optimal AI usage. Well, being used to actually look at x-rays and find defects or flaws or conditions at a faster rate than a human can. Given a number of symptoms, can it understand how quickly someone would actually come down with a condition? But it's not trying to do things that are totally new and out of bounds today. It's really taking things that current hospital and medical teams do and do it at a more efficient and a more faster rate. And that's really the key for using AI right now as a tool, as opposed to a replacement of hospital staff. First of all, generative AI is really a broad term, and it's used to describe any artificial intelligence that can generate new text, images, videos, and audio clips on its own with very minimal human involvement, right? So you want to think about data foundation, data fabric, and data governance. And data foundation, what we mean by that is really implementing infrastructure and strategies. Data fabric is really an emerging approach on handling network-based data with a new architecture. And then data governance is really about implementing the controls in play and putting the right controls in place. And lastly, you want to have the right use cases, because you don't want to have use cases that introduce unfairness or bias. I do believe generative AI can effectively be used for accurate diagnosis, and I believe we're working towards that. The current problem is today, generative AI models will present inaccurate information as if it were accurate. And it does that because it either has a limited amount of volume, a limited amount of data, or the data set could be biased, or it could be just thinking of something incorrectly, it was fed something incorrectly by accident. And these are really known as hallucinations. As soon as we become better stewards of data management, data protection, and data usage, we'll be able to actually use more generative AI results for accurate diagnosis.